Hi, Garrett. Hi there, guys. Dr. Jake here from Chiropractic First of Rockford, and I'm going to touch base on a issue I hear a lot in the clinic. People are always complaining about elbow pain, forearm pain. Usually, it's coming from the forearm itself. Usually, a repetitive motion. Most times, what I see, landscapers, bartenders, people that work in construction, even office desk, it's just repetitive motion over time causes wear and tear within the muscle, little micro trauma, and causes what's called, first of all, trigger points, which are hypoxic areas. That means that that area of the muscle isn't getting the oxygen it needs. And so you get these little tight little trigger points, eventually causes what's called fascial adhesions that shorten up the muscle, or at least what the muscle is capable of doing. And now you have what an area that a rope that should be this long to this long, that's now cut into maybe a half or three quarters of what it should, and so it's pooling on the attachment sites. So a common name for these are lateral epicondylitis or medial epicondylitis, just depending on where the pain actually is. And more common names is tennis elbow or golfer's elbow. And so once you have this, it could linger for a decent amount of time because you're still consistently doing your work. You don't give that area a break. And eventually that's going to start pooling, causing inflammation right in this spot. And these forearms are going to feel like a rock. Okay, so how do you fix it? Well, you don't go to the inflammatory site or the painful site because it is inflamed. You keep doing this, it's going to be like poking a bicep tear. I used that analogy before. Poking a bicep tear is never going to recover. It's always going to keep getting inflamed. So you have to go below the attachment site or the elbow pain and start working out these guys. Okay, so the way I do it is a really simple pin and stretch. It's shortening the muscle, okay, from attachment to attachment, shortening it. And then I use my thumb up. So thumb up, and then I press down. Now, when I press down, I press into the muscle and then towards the elbow. And when I lengthen it, I actually bring that thumb all the way down and straighten the arm. And I just work down that muscle. The more times that I do this throughout the day, the looser that muscle is going to get because you're breaking up those adhesions or those knots, so to speak, that are pulling on that elbow. You give a buffer to that elbow, the inflammation starts dissipating, the pain goes down. Another thing you could do is what's called a cross fiber massage. And let's see if I can get that right. And you're just going to go back and forth all the way down the muscle. What that's doing is bringing blood flow to those areas, taking away any trigger points, and helping relax that muscle to give you, again, a nice little buffer. Now, when you get home at night, what I suggest is grab a ice cube, or you could use a Dixie cup, a paper cup that's frozen, so you can fill it up with water, put it in the freezer, and use that when you get home. Grab it, peel some of it off, and you could do what's called an ice massage, which is just hitting that elbow area until that ice is melted and the area is numb. That's going to deplete some of the inflammation. And then you can do some work on the forearm again. Another tool that I use is this is a scraping technique. Uh, I would go, if I ever try doing something like this myself and you're not used to it, I would go super light. I'm talking very light, about 30 degrees up and down that muscle. I use cocoa butter just as an emollient, so that way it's easy to work on the skin, because you do it on dry skin, it'll just get irritated. But you could use conditioner, anything that glides, and I would go really light. Now, I've used the back of a butter knife before. I've used the back of a scissor handle, but I've probably done over a million of these, and so I could go a little more aggressive than most. But if you do, go very, very light over time. That'll start dissipating some of the elbow pain and loosening up some of the forearm issues. I know that some people who have experienced that type of pain, it can linger for months and months. And it is actually a really easy thing to fix if you know how to operate that. So again, if you guys see me in the clinic, you need additional advice on this, You can always grab a card, and has my personal email on there, drjakelevere@gmail.com. Very easy. But otherwise, guys, I hope this was helpful. Have a wonderful night. Have a wonderful day. I'll see you soon. Love you.